Well, good morning. I will try to be as quick as I can talking about antibodies this morning. Thank you, Chairman Alexander, Ranking Member Murray, all of our witnesses for being here today. As our communities focus on how safely get back to work and school, just like we're all talking about, we know we have to follow the science and adapt to new information to be sure that we're making timely, targeted, and thoughtful decisions protect both lives and livelihoods. So, Dr. Fauci, the last time you were here, we talked about the monoclonal antibody treatments, and I'd like to follow up on that conversation if we could. As we've learned more about the virus, how it functions, how it's different from other respiratory illnesses, what updates can you tell us about the development of preventative treatments that block the virus from attaching to the cells that it's targeting?
Well, thank you for the question, Senator. You mentioned monoclonal antibodies. Monoclonal antibodies are going into trials right now, and a number of trials sponsored by a number of groups. Hopefully, within a reasonable period of time, we'll get information as to whether or not that's effective, both in the prevention as well as in the treatment. Those antibodies are directed against a component of the virus that is what's called the spike protein. And that protein is the one that binds to the now well-established receptor in your body for the virus, and that's a receptor called ACE2. There are a number of other studies that are not necessarily antibody studies, but studies that have an effect on the virus itself and its initial replication. In answer to a question that the chairman mentioned just a bit ago, is that there will be therapies that we will be giving, some for treatment early on and others for prophylaxis. And as we hope, as we get into the fall and winter, we'll have everything from small molecule treatments and prophylaxis to the kinds of antibodies that you're talking about. So there's a lot of activity going on to do that early in disease, both for prevention and for the treatment of early disease.
I know that you've been doing a lot of serology testing and that individuals are presenting with antibodies. So out of the 5 types of antibodies that people are most likely to have, which ones do most recovers patients? Which ones do they show? And if one of these specific antibodies are present, does that make a difference in if the patient can be reinfected or not? Are they effectively immune, at least for some period of time? What kind of answers does this give us if you do have the presence of certain antibodies?
I'd love to give you a really precise, scientifically based answer, but the fact is we don't know. Standard-wise, when you get an acute infection, you get an IgM antibody. As you go off in time and develop a more mature immune response, it becomes an IgG. There are subclasses of IgG, some more protective than others. The thing we don't know, Senator, that we will know in time, but it's going to take time to know it, is what the relationship between the neutralizing antibody and binding antibodies that don't neutralize, what is the relationship between the titer and the degree of protection, and what is the durability of protection? We've seen some puzzling things. We've seen people recover from COVID infection and find out they don't have very high levels of antibody. Could it be a cell-mediated response that got them through the illness? And some other individuals have very high levels, and we don't know how long those levels last. So we're getting there with regard to our knowledge, but it's going to take several more months to a year to really be able to definitively answer your question about the role of antibodies in protection following natural infection.
Well, building upon that, I'd like to ask this question then. We know that this virus affects, is multi-organ. It can affect your kidneys, your lungs, your heart, producing strokes, all kinds of things, your digestive system, your sense of smell. So on the science that you're talking about in the antibodies, is the science of stopping the virus from causing harm the same regardless of which organ it attacks? And how do we help direct funding for the kind of research that you're going to need to look at this multi-organ attack of this virus, if you will?
This is a very perplexing virus because it's a respiratory virus and it gets in through the respiratory tract. If the virus stays in the respiratory tract and doesn't go systemic, to involve other organs. That's good news because you don't get very sick. The other side of the coin is your antibody response is not as potent because when you get systemic involvement, invariably you will have a more potent and robust immune response. So many people, and probably the people who are the asymptomatic carriers, they have a reasonable titer of virus in their nasopharynx, but the virus doesn't go any other place in their body. People who get multi-system disease that get triggered by the virus, those are the ones that unfortunately get more sick, but also the ones that make a more potent immune response.
Thank you so much. I appreciate you all being here today.
Thank you, Senator Rosen. Very interesting questions.